All right, gang, this is episode 2 of our clinical vlog, and my focus for most of them is going to be showing everyday dentistry and some of the things that we're doing in our practice. And so many of us focus on the fancy things and all the things that go perfect. I figured that I'll start showing things that don't go perfect or some of the everyday stuff. And as a PPO dentist, the things I hate to do most are composites, and especially hate doing anterior composites because the perfectionist in me always wants to do a good job, but then the business person in me always wants to figure out, like, how in the world can I do this for 180, 200 bucks and make it look make it look as good as I want it to look. And then it's compounded when I see all the beautiful work some of these fancy dentists are doing on the internet, and I'm like, I'm not any good. So this week we have a lady who has a chipped front tooth. It's been like this for a little bit of time. For some reason, she finally wanted to get it fixed on tooth number 8. And I'm going to share with you exactly how we're doing this using a single composite shade. In this particular case, we're doing a B1 body shade, and I'm going to walk you through everything we do, and I hope you love this. All right, welcome back to episode number 2, and in this case we're going to be doing a direct composite on tooth number 8. The patient has a chip and would like it to be better and match more with number 9. So we begin by taking a fine diamond and beveling, and then we'll use etch. I always use etch with anterior composites like this, and then in this case we're going to use Prime and Bond Prime and Bond Elect to bond the area, air dry it really good, and then cure it. Now we're going to place a clear mylar strip. Here we're having trouble getting it in, so we use the pop technique. And then I'm going to go ahead and build out the lingual and incisal wall. And I think the important part in this particular case is I want to show you that while, listen, this isn't going to be the most beautiful case, I've seen much better, but a single shade composite. This is a B1 body composite. And then so now we did the incisal edge. Now I'm going to use a strip to help build up the mesial and the distal contours. And then basically at that point, our focus is on getting the facial built out the way we want. I always like to get the incisal edge done first, then get the mesial and distal done as well as possible, and then start working on the facial contours. And then we do it in a couple of different layers. Be careful not to add any bubbles. And then I try to get it as close as possible, but I'm not overly worried about it because I'm going to adjust it. So here I go ahead and check the bite to get sure I have my linguals corrected. And then once I have that done, we'll use some sandpaper discs to go ahead and rough contour the restoration. I don't mind leaving sharp edges because square edges are much easier to turn into round edges than having round edges turn into square edges. So I'm not overly worried about the mesial of number 8 at this point. So now we're going to continue to just keep contouring it, try to get as close as we can, try to match site number 9. And here we go. We're continuing to contour, getting it exactly or as close to exactly right as possible. Check the bite. And now I think I'm at a point where I'm pretty happy with it. Now I'll take some articulating paper and we'll be able to see the facial anatomy of the adjacent teeth. And in this case, we're going to use a blade to kind of scratch in the composite, that same line. And then we're going to use that same finishing diamond to add some facial mamelons and facial pericymata. And here we go, just accentuating everything. And then coming back in and lightly polishing it some more, taking the next step in our disc and continuing to do our polishing. Here, now we're going to go ahead and use some diamond polishing paste to go ahead and clean the area. We're pretty much close to being done here. I'm going to take a sandpaper strip, get in between, make sure we have a nice smooth contact on both sides. And here, once I've got this done, I might make some additional adjustments on the contouring of those incisal edges to get the roundness the way we want it to be. So again, this case was done with a single composite, a B1 body. I'm firm belief that if you get the shape and contour correct, you can be off on the shade and the opacity, and the patient won't notice. So here we go. Whew, I'm tired. Not really. So I hope you enjoyed that. And here's what's important to me. If there's something specific you want to see, just drop us a line, direct message us, email me, so that I know what you want to see, and then we can create it here in the office. So thank you for watching episode 2. Don't forget to check out our podcast, and don't forget to support 3D Dentists, who makes all of this possible. We provide education that will change your practice and make you earn more money, do more dentistry you love, and take more time off. So www.3d-dentist.com, and I'll see you on the next episode.